Welcome to Health Tech Matters, a podcast brought to you by the Pankhurst Institute at the University of Manchester. I'm your host, Vidya Sharma. In the next episode, we talk about team science and the importance of interdisciplinary working when developing new health technologies.
We started to recognise the importance of all sorts of different people that make digital health happen, and they can be quite invisible at the end product but absolutely integral to what was developed. So we started to create an environment where those people could flourish.
We're joined by Ruth Norris and Charlie Stockton-Powdrell. Hi Ruth and Charlie, it's great to have you here this morning.
Good to see you, Vidya.
Yeah, hi Vidya, thanks for having us.
No, thank you for joining us. So I want to start by talking a little bit about your backgrounds. I'd love to hear a little bit more about your journeys. You both come from very different backgrounds. However, you've obviously coalesced around the theory of team science. I'd love to hear a bit about how that collaboration came about and how you got to the place where you are today.
Okay, yeah, so I'm Ruth. I had a bit of a journey getting here. It's the place I realise now that I always wanted to be. I just didn't know digital health or team science existed, and it turns out they do. So I have a background in cognitive science from a training point of view, did my undergraduate in that, and then came up to Manchester to do a master's degree, fell into some work in financial services, worked in that for 10 years doing programme management, transformation, change management, and then felt like I wanted to do something a bit different and moved to the university and started to use those transferable skills for digital health project management. And through that journey, we found out about something called team science. And that's why we've come to talk to you today about that.
Great. And how about you, Charlie?
So I have a background in human resources and recruitment and went to university a little bit later in life to study psychology. And I never wanted to work in research because I thought it's all about statistics and that wasn't what interested me or floated my boat. And so I started working as a research assistant in health psychology just before I graduated. And then I've worked in health research ever since, and with a digital health focus for the last 8 to 9 years. And I think there are probably things from before my research career that have helped with the way I work now. So I guess bringing some sort of diversity and some different experiences to working in health research have helped. Some experience in the NHS, which I think is quite valuable for working so closely with our NHS colleagues. And I think, as Ruth said, it's about that sort of diversity of background, bringing together different disciplines and different experiences to help enrich the sort of team science approach to research.
Brilliant. I mean, that sounds absolutely fascinating to bring backgrounds from industry as well as from frontline healthcare and bringing those into the digital health academic space. People might say, as academics, we all work in teams anyway. We work with collaborators across disciplines, and papers are always written by multiple authors. It's never a one-player game. But can you tell us a little bit more about what team science then exactly is and how that is supposed to enrich the way we do research?
Sure. So team science is a huge area, and the way that it's applied will depend on the domain, the organisation, etc., and what's needed from a project. But in our world, one of the key ways in which we feel we've made a difference is around recognising the role of non-academics in research. So health informatics, by its very nature, is has to be a very multidisciplinary activity. Health informaticians really need to work with a clinician, they need to work with a statistician, etc. So it's really a very, very sensible place to have team science. I don't think you get very far if you use the traditional model. So we started to recognise the importance of these different skill specialists. So we've got digital software engineers, we've got bioinformaticians, we've got public engagement, communications, project management, IT specialists, DevOps managers, all sorts of different people that make digital health happen. And they can be quite invisible at the end product, but absolutely integral to what was developed. So we started to help to create an environment where those people could flourish and really show and add the value that their experience can give. Also, on an individual level, a lot of people have a background that could adds something that you don't know about. So we have a software engineer in our group who's an incredible developer, but he also has an experience as a nurse on the front line. It's beautifully applied in what he codes, and also he's a gaming enthusiast, and that led to hospital simulation. So it's a game where you simulate a hospital environment and pick people into roles, and people can really see what it's like to work in hospital. And that's something that we developed with our director of our centre, George Moulton, for training. And so you've got 3 different life experiences coming together in one role. So by letting that person be blurry, by letting them be open and using all their different skills, you get to bring that extra energy and that extra value.
Fantastic. I absolutely love that example. And I also love the term blurry. I think it's all about trying to blur the lines between, not just between different disciplines, but also between the different skills that individuals bring into the team. So, Charlie, thinking about what Ruth said around incentives and around rewarding those that contribute to academic research but may not be perhaps motivated by the same traditional accolades as academics, i.e. published papers or research grants, how can we motivate these to work in science or academia and indeed contribute as Ruth has described?
I think that's a really good question, and I think it's something we've been thinking about. So Ruth and I are both professional services staff, so we're not academics, and I think we and our other skilled specialist colleagues add a lot to the research outputs that we work on. And as Ruth had said, there are lots of different roles that underpin and support research that are often unseen and unrecognised. We have the opportunity, I think we're fortunate to have the opportunity with the teams we work in to provide different contributions and have recognition in different ways. So some of those may be contributing to papers, some of those may be opportunities to present at international conferences, which Ruth and I both have experience of, which is really exciting, and we're delighted to tell you a little bit more about that later. And I think just having that conversation with people and saying, what motivates you, what encourages you, what do you value in terms of recognition, what's important to you. And for some people that will be career opportunities or development opportunities. For some people it's simply the recognition of people saying, thank you, you've done a great job. And there are lots of different ways in which you can recognise people within the university. So there are different awards that people can be nominated for. And I think it really is just about having that conversation and letting people know how valuable their contribution is, and recognising that outside the traditional academic world that we're kind of on the edge of, if you like.
Great. Now, we know that it's difficult to attract and retain high quality individuals these days, not just in academia or on, as you say, the edges of academia, but across industries. So I wonder whether you've got a thought around working in digital health specifically, which is of course revolving around patients and citizens and how we can enhance their care or their life experience. Perhaps there is a potential for that to be an additional motivator for individuals to come in work in these teams?
Yeah, I think that's right. Certainly for me and people that I know in the space where we work, different types of recognition are really key. So a university can't necessarily match some industry salary scales. However, there can be a freedom in academia that is really desirable for a lot of people. However, in professional services or the skills specialist space, that decreases somewhat. So if we can make that more open, give people these opportunities to really express themselves and bring this value, then that may well be a retention factor for a lot of people. I'd say it was for me. And there's other examples like the Data Saves Lives campaign, which started off in a communications team. Somebody just had an idea saying we just need to get this message out there that digital health is important and that data safely used, well governed, reused can really have a benefit. And that was not something specified in our funding. It was not something that we were funded to do per se, but by funding a communications and project management hub as part of a programme that we were funded by a Medical Research Council, we created something that didn't exist before, that nobody knew that we needed. And it has grown and created as something completely different, and is now its own entity. It has its own hashtag, it has its own Twitter account. MPs and Lords have signed up to the campaign and wear the badge with pride, and also there are a number of government strategies and documentation which use this title now. So nobody knew we needed that, right? Somebody came in to come and do the comms for our centre and just blew it out the water. So I've completely forgotten what the question was, but I was excited to share that with you.
No, absolutely. And thank you for sharing that. And I think that comes back to what Charlie was saying earlier about recognising those teams that perhaps sit slightly more on the edge of traditional academic models. And do you think over the years you're seeing that there is a greater recognition of that? It's certainly in my experience, I wonder whether the role for communicating our academic outputs, which are traditionally written with lots of jargon, that are written in certain styles, that are not very accessible, that are not very inclusive, means that the value of that research, perhaps to the wider public domain, is lost. And do you think this is where elements of what you've talked about need to be mainstreamed within academia?
Yeah, so I think there are still lots of academic outputs that are being produced from the research we do. But also we're trying to think about different ways to communicate our research and to engage with communities, with the public. One of those ways is we've engaged the Contact Theatre to do some work for us. So for a particular project that I worked on, we had some artists who would telephone people who had taken part in the project. They would ask them various questions and they would ask them to move around their house and to engage with everyday objects within their house. And then an artist at the other end of the telephone would draw or sketch out something that visualised the experience. And that was a really unique and novel way of engaging with and producing outputs from research. And I know that a big project that Ruth worked on, the Connected Health Cities programme, had an orchestral musical output where it was very theatrical. There were composers who had written particular pieces of music for particular outputs. And again, that's something that is getting people to think very differently and sort of diversely about ways in which we can engage people and ways in which we can share the outputs of our research.
Yeah, I think that's right. And I think when these things are given the space to flourish, they are well regarded. One of the challenges is sometimes the way that in which research is funded doesn't necessarily allow the space for certain roles or resources to be included. When you've got an objective, we've got to meet that objective and move on to the next thing. It's sometimes hard for people to recognise the value of investing in some of these extra things like public engagement, communications, project management, IT. They all just seem like costs and not value. And it's helping people to show the examples of where those things have made a massive difference, and helping funders to fund things in different ways so that we can really start to make those changes.
And I think to add to what you've just said there, Ruth, some of that funding needs to either come from core infrastructure funding, so these calls need to be made available, or there needs to be some infrastructure funding that can be made available through research grants. So we have had some infrastructure funding in the past for the Healthy Research Centre and for Connected Health Cities. And that was crucial in terms of funding communication roles, project management roles, operations roles. And some of those are more difficult to fund subsequently since that infrastructure funding has ended and we're looking at research funding. And that's a challenge that we're facing constantly. And we're trying to retain good, excellent staff, in fact, through research funding, which is sometimes a little tricky.
This podcast is brought to you by the Christabel Pankhurst Institute at the University of Manchester. It's a partnership between the University of Manchester and the NHS, public sector and industry. Our mission is to make positive change in health and care for all through multidisciplinary and collaborative development, evaluation and implementation of new health technologies.
So picking up on that, I wonder, do you have any tips or advice for anybody out there in a different academic institute who might want to engage their leadership or their senior stakeholders with regards to some of these points? And how do you think they'd be able to, I guess, make the case for team science and this wider infrastructure-based funding?
There's a few different ways, I guess, but it's kind of taking the moment to really think about of what you're doing. It's a bit like somebody says, "What do you do for your job?" I'm not really sure, and you're too close to it. You don't realise what you're doing all the time. So I think if they did maybe an audit, or got somebody in to just assess what they're doing in the team space, or went to a conference about teams and started to recognise, because that's exactly what happened to us. So we had some investment from the university called Investing in Success, which paid for myself and a couple of colleagues to attend a conference in the States where team science is much bigger. They have huge National Institute for Health grants. They're absolutely massive. So the way that teams work there is absolutely key. So they have a lot more background. So we went to this conference and found out team science is a thing. We just went to talk about how we'd use specialisms of communications, project management, and public engagement, PPIE, and we found out that what we were doing was real. It was part of a proper theoretical movement. It's a domain. There's lots of things to learn. So I think people probably just need to take a moment to see where they're doing it already, show the value, maybe try to write a paper about that, or to get the academic buy-in. Try to increase retention of people in those roles, and maybe go to some of these conferences where they can start to get more tools and knowledge and things they can bring back to their practice.
Yeah, I think that's great, Ruth. And you talked about publications about team science as well. So I managed a project called the Wearable Clinic a few years ago now, which was a project that involved colleagues from computing science, software development, electrical engineering and health informatics. And it was very much a team science approach. And one of my colleagues, Matt Machin, is leading on a team science paper to talk about our experiences of how we applied a team science methodology to our working, and ways in which we managed to sort of make the most out of the interdisciplinary working and the value and contribution that everybody made. And I think also it's really important. You talked about how you can potentially get support from your university. And I think we're very lucky because Professor Nigel Hooper, who's the Associate Vice President for Research at the University of Manchester, and Professor Colette Fagan, the Vice President for Research, Ruth and I are actually meeting with them next week because Nigel supported and funded a subsequent trip to the Science of Team Science conference that Ruth and I and a couple of others attended. And Nigel is really keen for us to be involved in the implementation and rollout of team science at the University of Manchester. So I think there are some really exciting opportunities coming up in the future.
Great, fantastic. I think from what you're saying, both of you, I wonder whether perhaps lots of places are already doing team science, or perhaps part of it. They A, may not realise that, and B, they haven't had the opportunity to formalise that. And there is value in that formalisation in terms of recognition, in terms of potential funding, in terms of potential research outputs. So you mentioned that in the US, this is more commonplace, and things are perhaps a bit more advanced. Could you tell us a few examples from your experience at the conference, or other examples that you've heard of?
I went to a really good workshop at the 2018 conference, run by somebody called Andy Hess, which was all about interdisciplinary translation, which looked at how do projects where many very different domains are working together make sure that they all are hearing the same thing from one another. It's a bigger problem than you might think. So there's things like, for example, if I said to you MVP, Vidya, what would you interpret that as?
I would think minimally viable product.
Yes. That is one interpretation. In America, they all said, what? The first thing we'd all think of there would be most valuable player. So, that happens all the time. There's lots of terms and statistics and different fields that mean just, it's not that they don't know them. More dangerously, they do know them, but they mean something else. So the argument in this workshop was about having somebody, like a project manager, some sort of facilitator, to unpick that, sort of see it happening, test assumptions, keep people on the, have dictionaries, have all those good things, ask what seem like the stupid questions, what does that mean? Because quite possibly different people think it means different things. So we had a really, really good workshop about that there. So we actually invited Andy to come to the university and repeat that. And we had people from right across the university all come to that, and they absolutely loved it. So that would be something that I really learned about, would be interdisciplinary translation.
Great, that's a really, really good example. And I love that, because the question I wanted to come on to next was working with clinicians and healthcare professionals. And this is certainly something that we have experience of, even within different medical domains. At medical school, I remember there was always this example given when in the notes someone would say, oh, blood test X, Y, and Z, NAD. And NAD, people thought, would stand for no abnormality detected. But an alternative NAD could be not actually done, which of course means something very different to no abnormality detected when it comes to test results. So I completely hear you when you're talking about translation between disciplines. So how have you found working with healthcare professionals and clinicians, especially, as we all know, the health service is under tremendous pressure, and frontline staff are, of course, time poor. They do not have perhaps the capacity to work with academic teams or research teams. What's your experience been like over the last few years of that?
Yeah, it certainly can be tricky, and naturally clinicians have a focus on patient health and providing the right kind of clinical support for patients, and that's as it should be. And we have found sometimes that we've had clinicians who we've been collaborating with on a project who have found it difficult to commit the time that we'd like them to, or that they'd like to the project. One of the ways we've tried to overcome that is by perhaps sometimes engaging a couple of different clinicians from a particular specialty, and that also provides different perspectives as well. We have found that sometimes engaging with the clinical academic can be quite useful because they have that invested academic and research interest. And sometimes actually just finding a really enthusiastic doctor who is really passionate and interested in your area of research to engage with, and that can be quite useful as well. I don't know if it's fair to say that junior doctors may have less administrative responsibilities. I'm not necessarily sure that they have much more time. It's probably fair to say.
Yeah, that's really interesting to hear. It's something that I often wonder about. I think traditionally in research, as well as perhaps with industry partners, there is an attraction to engage perhaps more senior clinicians across the board, from nurses, physios, medics. But actually, with regards to gaining real-world insights of what it's like to be on the shop floor, what it's like to be interacting with patients, I often think there's actually a lot of value in engaging the ward nurse rather than the matron, or engaging the foundation doctor rather than the senior registrar or the consultant. And similarly, typically, whenever we think of digital health, there is a focus often on doctors or clinical academics. However, I wonder whether there is a lot of value in speaking to non-doctor healthcare professionals. Have you guys had any experience of that?
Yeah, that's a really good point. And I think it's not necessarily allied health professionals, but people like practice managers, can be a really important gatekeeper in relationship with the GPs, or and helping to win hearts and minds, perhaps, and access things. So hierarchy isn't always helpful in working out who the best people might be to be involved in something.
Yeah, we do quite a lot of work in digital mental health, and so we work very closely with care coordinators who are not doctors, but who are really key clinical staff who work very closely with patients and service users, and their input is always extremely valuable, particularly those who have an interest in digital mental health, but also those who aren't as interested, because sometimes they can add a dimension that you haven't thought about, or they can make you aware of some challenges or some barriers that are really important to overcome. So I think engaging more broadly with the clinical teams, as you suggested, is really quite important and really valuable.
Vidya, can I ask you a question?
Of course.
Excellent. So what's your experience of team science? And honestly, we'd really like to know. So do you think, as a researcher, medic, all good things, that the team science model has had any impact, positive or negative impact on you, or just your thoughts would be really interesting.
Yeah, thanks for asking me to share. So listen, I think for me personally, I'm completely bought in to the idea, and that's because I've personally had tremendous positive experience of working with designers, developers, project managers who have not just added value to my projects, but have also taught me a lot. So my growth and development during my PhD was largely due to my interactions with these individuals across disciplines. Having a new way of thinking, a new perspective, or being able to appreciate what we talked about earlier, translating between different teams, is super valuable. And I wonder whether, as a clinical academic or as someone who is perhaps in a leadership position, there is tremendous value in having that experience and being able to be that person who says, well, you're saying MVP, but I'm really sorry, but what does that actually mean? And if you are the person who is supposedly in a leadership position and has the humility, or displays that humility to be able to do that, that permeates through the whole team, right? So for me, that's something that has been tremendously valuable, and I've loved it. I've learned how to design, I've learned how to make prototypes, I've learned how to run user workshops, and all these skills that I otherwise would never have picked up from a traditional academic PhD where I was just focused on research, traditional research methods. And also, to add to that, I wonder whether this is something that we need to learn in academia generally from team science, but also perhaps from other industries where people work in far more agile, iterative ways, and bring that kind of way of thinking, that kind of way of working into academia. And you do that by having what we started off talking about today, right? You've worked in industry, Charlie, you worked in other places, and that makes a real difference. You bring that knowledge, that experience into the academic field and cause a disruption or cause a new way of thinking. And I think that's super valuable, and we need a lot more of that.
We need grit in the oyster.
We need more constructive disruptors.
Perfect. Thanks so much, and thanks for asking me that. So what's next on the horizon for you guys? Have you guys got any further projects planned? Any plans to try to expand this idea? I'd love to hear more about what's next.
So we've got the International Centre for Translational Digital Health, which I'm the programme manager for. And that's a collaboration between the universities of Manchester, Toronto and Melbourne. And it's very much an interdisciplinary or team science collaboration between the three universities, which brings together leaders in digital health, computing science, health policy and implementation, brings people together to try and find ways in which we can collaborate more internationally, share the knowledge that we have between us, look at filling any gaps that we may have in our own centres, and really try to create a sort of world-leading centre for translating digital technologies into the healthcare system. We're just over a year old now, and we're looking to develop things further and to introduce a joint PhD programme, and I think there'll be really exciting things to come from the International Centre.
And that International Centre is obviously part of the Pankhurst Institute, which runs these podcasts. I'm the operations manager for the Pankhurst, and our aim is to create an environment for industry partners, NHS partners and allied services providers and academic or institutions, including all the skill specialists, to come together in working in an agile way to move technology along the translation pipeline. So we're going to be having a whole series of different workshops. So just as you were saying, agile is going to be really key in the Pankhurst. It's something that the university isn't necessarily used to doing, but it's something that we are used to doing in digital health. So we're going to apply that to the Pankhurst strategic objectives.
Brilliant. Thank you so much for sharing those future visions. And thank you so much for joining us today. I absolutely loved hearing your views and perspectives. And also thanks for asking me a question. That's not happened before.
You're welcome.
Yeah, thank you.
Thanks.
Thanks a lot, Vidya.
In the next episode, we talk about the role of technology to support the physical health for patients suffering with mental illness. We'll be joined by Dr. Joe Firth, who is a leading expert in this field. So I hope you can join us.